Today, an increase in concussion cases have led to 5.3 million Americans currently living with a traumatic brain injury. Concussion patients have to go through a long process of recovery with their physical therapists and doctors. In most cases, concussion patients need to have a full recovery through a process called RTP, or return to play, before they can go back to 100% activity.
Concussion is a metabolic versus a structural brain injury. The old recommendation is that you would do no activity or increase of activity until you are symptom-free and you had a negative neurocognitive exam. But current recommendations have changed. They've done more research and found that a graded return to activity sooner, as long as it's monitored, can be safe. So one protocol by the guidelines from international conferences on concussion in sport talks about how at phase 1 you would do no activity and you would rest. However, at phase 2 you could start activity as long as it's monitored. You have no symptoms, but also that your heart rate is below 70% of your maximum. So in other words, effective monitoring of patient symptoms and heart rate are important for recovery, to objectively show patients and therapists when it is safe to move to the next level without depleting the needed energy stores for the brain. It's very easy to overdo it after sustaining a concussion. Symptoms can be exacerbated, causing a delayed recovery. The brain needs time to restore balance with its energy stores, and we do not want the patient to overutilize available energy for brain recovery. Guiding a patient to stay within a specified heart rate range while allowing increased activity if symptom-free is how we can progress patients safely through post-concussion rehabilitation.
As explained, monitoring heart rate is very important. It is tiring to have to stop every few minutes to check your pulse. The RAN concussion recovery device will help patients monitor their heart rate during activity without having to stop. Our mission is to create a platform for integrated medical technology, bringing parts of ideas to make a new output for a device that will improve recovery and work towards recording and analyzing heart rate for future research on concussions. We have designed a powerful, innovative system by integrating the Arduino Uno circuit board to communicate with an Android app through Bluetooth. The device is personalized for the patient with an Android app that allows the patient to enter their age to find their maximum heart rate. Using their maximum heart rate, the app then calculates the patient's target heart rate based on the percentages recommended by their doctor. When the patient is using the device, they can start a stopwatch in the app for when they begin activity and stop it as needed to recover after reaching their target heart rate. If the patient is experiencing any symptoms or noticing anything different, the app enables the patient to type in any notes. The device is settled on the arm, very lightweight and sizable for everyone. The pulse sensor wraps around the tip of the patient's index finger to detect a pulse. The first layer of white fabric that the electronics lay on top of is a protectant from irritation of the skin and infection. The red band around the pulse sensor is an adjustable Velcro, thus is flexible to fit different arm sizes. The second layer of black material is used to cover all the electronics to prevent unneeded exposure and damage. The device is currently powered by a 9-volt battery. Further development will integrate solar and other ecologically friendly power sources. We are building and improving a device with unlimited capability of processing psychological signals like heart rate into outputs of interest, further facilitating research on concussions and reporting data. Doctors and physical therapists can create more effective plans for recovering concussion patients to ensure the safest and fastest recovery through effective monitoring. We have created a technology that will advance the healthcare technology of the future that can facilitate better recovery. Monitor the patient's heart rate to overcome post-concussion difficulties. We do this by using technology to integrate monitoring of patient's heart rate to validate whether or not the patient is going over or achieving their target heart rate recommended by the doctor. Once the patient is able to be active within their target heart rate without any concussion symptoms coming back, they can exceed their recovery. Use of this device will educate patient users and allow them to take social actions to educate others on concussion recovery. Individual use of this device will help advance concussion research. The Concussion Recovery Device, a project created by RIN.